Good evening. Listen, please, let's talk. Today, I want to talk about DVT. The full meaning of DVT is deep venous thrombosis. I am dedicating today's video to this, my lovely cousin sister. Her name is Bolebi Fuludu, aka Bansi. We lost her a few years ago to this disease condition that we're about to discuss now. It was very painful back then. At least now I'm able to talk about it without tearing up. So I am dedicating this video to her as a memorial to remember her and, let her know that she's loved and her memory lives on in us. Now, deep venous thrombosis is a thromboembolic phenomenon. What it simply means is that the deep veins of the legs are, the blood inside there are forming blood clots. Yes. Thrombosis simply means blood clots inside the blood vessel. Now, DVT means that there is a blood clot inside the deep veins of the body, especially the veins of the leg. Now, the risk about having a blood clot down there is actually the issue of dislodgement. If that blood clot gets dislodged, it can travel from that leg to your heart and block the blood vessels that carry blood from the heart to the lungs and instantly unalive the individual. The risk factors or causes of DVT include immobility or sedentary lifestyle, obesity, surgery, or trauma. Yes, if you had a road traffic accident or something. Another risk factor is pregnancy. We also have cancer, then hormone replacement therapy for patients that are taking all these hormone modulators or hormone medications, say for contraception or for hormone replacement due to one disease condition or the other. Then we also have inherited clotting disorders. Another one is use of smokes and tobacco. Yeah, that's another risk factor that can cause DVT. The symptoms of DVT include swelling in one leg. Now, nothing says that it cannot occur in both legs, but most commonly swelling in one leg, pain or tenderness in that same leg that you are having the swelling. Now, tenderness is when you have to touch the place to feel the pain, but pain is always there whether you touch it or not. Then there is also warmth, differential warmth. The area of the leg is usually warmer than other places, and there is usually pain in the calf. This pain or tenderness is usually at the calf. That place where when we're younger want to insult ourselves, we'll be like, see yourself with your yam leg. That part where we're insulting, that's the calf. I've inserted a picture here for you to see. Now, the other symptom is redness or discoloration of the skin. Another symptom of DVT, especially in patients that I've seen. Now, I won't really say this is a symptom of DVT, but it's a symptom of its complication. Yeah, let me quickly clear that up. And this symptom is chest pain. Chest pain as a result of micropulmonary infarct. Micropulmonary infarcts are usually small segments of the lungs that have died because of oxygen deprivation. What actually happens is that when that DVT occurs in the deep vein of the leg, small portions may dislodge. Tiny portions of it may dislodge, get to the heart, and those same portions will travel into the lung and block tiny blood vessels that carry blood to small segments of the lungs. And because of this oxygen deprivation, since they've blocked those areas and blood cannot get there, those small areas of the lung will probably die from oxygen deprivation, or they will not have enough oxygen and the patient will start having pains from those areas of the lung. Well, diagnosis is usually through suspicion. Like now you have come across this video, and if you are experiencing any such kind of thing, or if you think you have the risk factor, you just go and check. Now, there are tests that can be done after you have interacted with your doctor. If it thinks that you are having the symptoms, there are different tests that can be done. One of them is called the D-dimer, the other one is Doppler ultrasound scan, and so on and so forth. Now, the treatments, there are readily available treatments. Yes. Deep venous thrombosis is not something that should kill, because it doesn't just happen suddenly. You will have the symptoms before trouble starts. Yes, so if you can suspect and go on time and they catch it, it's not supposed to kill. Ideally, they can just place you on the medication. There are different medications for it. So after you finish your test and all that, your doctor will place you on a treatment regimen that will take care of it. The main complication of DVT is thromboembolic phenomena, especially pulmonary embolism. Pulmonary embolism is a life-threatening condition that is characterized by dislodgement of blood clots from that DVT. That blood clot travels to the heart, and then from the heart, it finds its way to the lung and block the two major blood vessels that are carrying blood into the lungs. It ends the life of an individual in a very short time if you don't get it out. And this is Nigeria. We don't have, even in places where all the facilities are available, it's still a life-threatening condition. People still lose their life to thromboembolic phenomena. How much more here in Nigeria? So it's better if you know the symptoms, if you understand the disease condition, and then you watch out for it. If you find out that you have the risk factor, you're experiencing any form of leg swelling, especially on one leg, warmth, tenderness, pain on your calf, you run to the hospital. Things not to do include massaging. You don't massage it at all, because if you go and massage it, you will dislodge that blood clot there. DVT has ended the life of very active individuals. DVT is one of those disease conditions that if it kills an individual, people will start blaming village people. They will catch winch, because you see the person very hale and healthy, talking to you 1 minute, and the next minute the person just drops. That's how it is. That's exactly what happened to my sister. She was very healthy, woke up, normal day, everything was happening. She stood up, was going to the market to buy foodstuff to prepare for the family. Only for her to run down the stairs, run back up, run back down, get into the car, run back into the house that she's unable to breathe, and that's the last we knew. We heard of her. Before they could take her to the hospital, the doctors there declared her gone on arrival. So please, if you have any of these symptoms, if you have any of the risk factors, do yourself some good and go to the hospital. There are simple tests that they can do for you. Then there are medications, treatment regimen that the doctor can place you on, and then you won't have to lose your life over this kind of preventable condition. Thank you very much for watching. Too good to share the video. See you next time.